Colorectal cancer is the third most commonly diagnosed cancer in men and women. Regular colorectal cancer screening is one of the most powerful weapons against colorectal cancer. I'm Daniel Craig, Cancer Outreach Coordinator with Tammy Walker Cancer Center.
Daniel, thank you so much for being on the show. We're going to be discussing colorectal cancer because of Colorectal Cancer Awareness Month. Why don't you talk with us about the prevalence of colorectal cancer?
Colorectal cancer is the third leading cause of cancer death in men, and it's also the third leading cause of cancer death in women. So when you combine men and women, it's the second leading cause of cancer death in the United States.
I know one aspect of your job is talking about prevention and risk factors. So let's talk about the risk factors and prevention for colorectal cancer.
So there's some risk factors that you can't change, like your age. Your risk of colorectal cancer increases as you get older. Colorectal cancer is more common after the age of 50, although there has been an increase in the number of younger adults that are getting colorectal cancer. African Americans have the highest incidence and mortality of colorectal cancer of any racial group in the United States. Other risk factors include being a type 2 diabetic and having a family history of colorectal cancer. Some of the ways that you can reduce your risk of colorectal cancer include getting to and maintaining a healthy weight, limiting intake of red and processed meats, and eating plenty of fruits and vegetables. It's also important to avoid excess alcohol and get plenty of physical activity. And then if you do smoke cigarettes, quitting smoking can reduce your risk of colorectal cancer as well as reduce your risk of many other types of cancers. And probably most important is to know yourself, your family history, and your risk factors, and to get regular checkups and cancer screening tests.
Which leads us to that next question, which is screenings. Why don't you talk about the various ways of screening for colorectal cancer?
The colonoscopy is the gold standard for preventing colorectal cancer. So all men and women should get screened with a colonoscopy starting at the age of 50. If someone has a family history of colorectal cancer, they should visit with their doctor about potentially getting screened at a younger age. Then in between colonoscopies, you can get screened with a stool-based test like a FIT test, which looks for blood in the stool. We're actually giving away free FIT kits during the month of March. People can pick them up at any of the pharmacies in Salina as well as Lindsborg, or they can give us a call at Tammy Walker Cancer Center and we'll be happy to mail them a test. Once they complete the test, they can mail it back in the prepaid reply envelope. We'll get the results back to them in about 2 weeks and also send a copy of the results to their doctor.
Daniel, thank you for great information. And thank you for watching. For more information, please visit TammyWalkerCancerCenter.com and like their Facebook page.